Intermountain Healthcare is helping out the community this time of year with their Primary Promise campaign. And joining me now for more is Kathy Welke. She is the Chief Executive Officer of Intermountain Primary Children's Hospital and the Vice President of Intermountain Children's Health. Welcome to the show.
Thank you so much.
What is the Primary Promise?
So Primary Promise is Intermountain Healthcare's mission, really, to create a model health system for children. Intermountain's been known as a model health system for years, and we want to make sure that that same opportunity exists for kids, whether they're in the hospital or they're in our community and just needing support.
Okay, so go into a little more detail. How does Primary Promise help enrich those children's lives?
So there are three parts to the Primary Promise. One is really improving upon the incredible foundations that Primary Children's already has. So improving cancer care, improving what's happening in our neonatal ICU and our fetal center and research, which is so important. So that's part one. Part two is extending expertise throughout the Intermountain West. So not every child has to come to Primary Children's for their care. And the third part is really thinking about upstream and how can we improve kids' overall health, wellness, and really mental health, because I think that's becoming one of the biggest challenges we have.
It's grown, hasn't it, since the pandemic?
It has.
It's a buzzword in healthcare.
Well, it was already on the rise before the pandemic, and then I think particularly for youth, that isolation really exacerbated things, and we're just seeing increased depression and anxiety, and we know we need to do more.
Talk about the new kid-friendly transfusion centers as well.
Oh my gosh. So the children who have cancer are cared for at Primary Children's, and a big part of their cancer care is hours and hours of sitting receiving, chemotherapy. And we now have a beautiful new transfusion center thanks to the generosity of this community, and the kids have bright, daylight, and it's just incredible for them. So instead of sitting in a dark, dreary room for 12 hours, they have a place that they can enjoy.
There's a feeling, isn't there, at Primary Children's? From the minute you walk in the door, it's different.
It is. You can feel, it doesn't feel like a hospital, it doesn't smell like a hospital, it has joy. And there are so many people who are working there, and the only reason they're there is they want to make a difference for kids.
You have incredible volunteers. We made a lot of them right here on this show.
They are?
That's why it works, is because of the volunteers. Do you help teens as well? I know we mentioned mental health.
Yes, absolutely. I mean, we treat teens for their physical needs, but also their mental needs. Wasatch Canyons is our behavioral health campus, and it treats kids from an outpatient standpoint all the way up to inpatient therapy. And there are a lot of teens that need help right now. And that's something that we really want to make sure kids are aware of. Not only for parents being aware of sort of signs and symptoms of kids having depression, and we have that on our website, as well as being there for them when they need the help.
All right, now we know a little bit more about the Primary Promise. If people would like to learn more and help contribute, what should they do?
They can go to primarypromise.org and they can contribute right there.
This is that time of year that people are in the giving mood and the giving spirit, and I don't think there's any better place than Primary Children's.
Well, I know I'm a nurse. I've worked at Primary for 40 years, and I know there's nothing that's more satisfying than making a difference in the life of a child. And others can do that too by their generosity.
Katie, thank you so much for stopping by the show. Happy holidays. For more information, please go to abc4.com/dailydish, and we'll link you to all of the information.